So this belies the idea that no one got well from a psychotic episode before antipsychotics arose. And remember, the Soteria project showed the same thing, that if they didn't immediately medicate people, people got at least close to like 70 to 75% got better and were able to live without antipsychotics over the long term. Now, there is something called open dialogue therapy that was practiced in Finland, was developed in the early 1990s. Their conception of psychosis was this: it doesn't arise within the head of the individual, but in the in-between spaces of that individual and their social environments. And so what they think is that you have to use dialogical therapies to repair those in-between spaces. And with their first episode patients, and this was a type of therapy that ran from around 1991 to 2015, they would not put them on antipsychotics right away because they wanted to see who could recover without going on the drugs. If someone wasn't getting better after a period of time, they would put them on an antipsychotic, a low dose. And then they would see after 6 months of those who had exposed to antipsychotic who could come off the drug. So what are their 5-year outcomes? 67% never used antipsychotics, 13% used them for a period of time, 20% continue use. It's a select, a selective use of antipsychotics is the model here, but they're putting their time and effort into repairing those in-between spaces, repairing relationships, helping people who are psychotic get over their fears and be with other people, to start have dreams again, think about what jobs they might have. Psychotic symptoms with this form of care, 79% were asymptomatic at the end of 5 years, and look at their functional outcomes. Only 20% on disability. So this was pioneered by they treated all patients like this, and basically they found once again that with the selective use and intense dialogical environmental care, which was meant to get people back into work, about 80% would have good outcomes at the end of 5 years, and only about 20% would become chronically ill and in need of the drugs all the time. This is a hospital in Norway, in Tromsø, Norway. There was a program there that was initiated by the Ministry of Health that said, and they looked at this very data that I presented today. Actually, I was invited to Norway multiple times to present on this data about the long-term course of antipsychotics, psychosis with antipsychotics. And the health minister said then, we need to give patients, including psychotic patients who come to the hospital, who don't want medication, the chance to be retreated in a hospital setting without medication. I went there. This is the group of peers that got together and lobbied the health minister to require every hospital system to start providing medication-free treatment to patients who wanted it. And here's what they say. One of the people in Tromsø: the people who come here don't want medication. This is their deepest wish. We say, you can come to us. We want you as you are. Come to us with your delusions, your illness, your thoughts and feelings and history. Everything is good. We can meet them as they are. When people experience that, something essential happens. It takes away the mistrust and the fear and says to the person, this is okay. And then the person can start growing. That is the most important thing. This ward has been now operating for, I think, 8 years successfully. They also help people come off medications. There's the psychiatrist who's pioneered this. And look what they say when patients come off. The patients often report when they taper, they get problems back, but they find new ways to deal with them. These people have very strong feelings about getting their emotions back, and this is also experienced by their families. One woman told us, I thought I lost my husband 4 years ago, and now he's back. You'll say this. In Norway, there's a group near Oslo that works to take people off their medications. And these are chronic patients with multiple hospitalizations. And 5 years later, after they take them off, 16 are medication-free, 7 completely recovered. Now, there's a Soteria project that started up in Israel based on the Soteria project that was done by Lauren Mosher. Whoops. I don't know what I did there. Anyway, they now have this first one started in Jerusalem. I think it was in 2017. They now have either Soteria homes or what they called equalizing houses, where people, it's modeled after Soteria. The idea is that by being with people, going on, as you can see, go out for hikes, that can be therapeutic. They cook together, they live together. They're not locked into these home-like residences. Some people are on meds, some people are not on meds, some people taper off. And what they are finding is that so many people, in fact, get better. And now in Israel, a few years ago, they provide insurance for this. And it's becoming closer to becoming the standard of care. And it's based on this sort of selective use of drugs. So here's the UN High Commissioner for Human Rights. And here's what he says about what we need. Our ambition must be to transform mental health services, not just in their reach, but in their underlying values, so that they are truly responsive to the needs and dignity of the individual. And then it talks about supporting a rights-based approach. Now, I could go on with things, but what you see over and over again is forms of care that try to provide people with safety, meaning in life. There's a group in Connecticut, what they do with people, it's called Volunteers for Psychotherapy. And what they do is people who are basically poor, been released to mental hospitals, they will give psychotherapy, 2 hours of 1 hour of psychotherapy to people who come into the program. But in order to, quote, pay for that psychotherapy, the people have to volunteer. They can volunteer in animal shelters, deliver meals on wheels to the elderly, whatever it might be. And the purpose of that is this volunteer work gives the people a sense of meaning in life, a sense of purpose, an identity, gets them into social situations. And that is very different than always being seen as the person who is being helped. But it's an example of creating a new environment for the people. You see programs that emphasize exercise that are delivering good results. You see programs that, basically help set up a residential setting in nature where people work in the gardens and live with each other. Those help many people get well. And over, what you see is that if you create better environments, better diet, places for people to socialize, places for people to find meaning, and be with others. And I'm not saying everything goes great. I'm not sure that saying that everybody gets well, but you do see higher recovery rates when you build better environments for people. And this should not be a surprise, because what do we all need? We do need meaning in life. It does help to have shelter. It really helps to have good social lives, to love someone and be loved. And so when we think about these calls for reforming mental health care, what we need to do is reject the disease model. It was a false model, and embrace this idea of that we humans are responsive to our environments. So how do we improve environments? So that's it. I'll close. I went a little long, but we'll have at least a few time for questions, and I will exit this.
Great. Thank you so much, Robert, for that extremely informative, if not shocking presentation